my YouTube channel. Is a girl there, Jane, and welcome. If this is your first time stopping by, thank you so much. And if you're a returning viewer, thank you for coming back. You guys are the real VIP. So, without much ado, on today's episode, we'll be discussing health matters. Yes, before you say who is this person coming to talk to us about health, my name is Jane and I'm a registered nurse midwife. So whatever I'm going to be dishing out here will be based on science and not mere assumptions and conclusions. All right, so this is October and it is Breast Cancer Awareness Month, and so I've come to tell you all you need to know about breast cancer. Let's dive right in. So this is October and it is Breast Cancer Awareness Month, and that is what I'm actually going to be talking about. What is breast cancer? In simple terms, breast cancer is when the cells of your breast have gone from being normal to abnormal. That's what it is simply. And there is no specific cause of breast cancer, but there are factors that put one at risk of developing breast cancer. The one on the number one on my list is age. The older a woman becomes, the higher the chances of breast cancer. And this is due to the hormonal changes that take place in the body of a woman. Now, the next thing is family history. If someone in your lineage had suffered cancer in past years or past time, there are chances that there will be reoccurrence for somebody else in the family. Now, the next thing is previous history of cancer. This is for people who had cancer in the past and got cured. There are chances that the cancer may come back again. Yes. The next is obesity. If you're on the big side, please look out for your weight. Obesity increases the production of a hormone known as estrogen, and this puts people who are obese at risk of developing breast cancer. The next thing is alcohol. Limit your intake of alcohol. It predisposes women to breast cancer. How do you know when something is wrong with your breast? The first thing is knowing the normal state of your breast, first of all, and then also knowing the signs of cancer. There are signs, there are things you will see and you say, something is wrong with this my breast, let me go and check. Number one is nipple discharge, which may be stained with blood. Number two is retracted nipples, when your nipples grow inwards instead of outwards. And this is usually the case for people who don't have retracted nipples from birth, because there are people like that who were born with retracted nipple. If that is not you and all of a sudden your breast nipple starts retracting, please go for a proper check. The next sign of cancer is if the skin of your breast suddenly start turning like an orange peel. I'll attach the picture for you to see what I'm talking about. Now, the next thing is lumps on your breast. Lumps on your breast. And you can only detect this lump if you carry out self-breast examination. And what is self-breast examination? It is the examination of the breast you do from the comfort of your home. Nobody does it for you. You do it by yourself. You get? So how do you do this thing? First of all, you do it at the right time. And when is the right time? 3 to 5 days after your menstruation. This is because your breast tends to be on the normal state at that time of your monthly cycle, 3 to 5 days after your menstruation, because there won't be any loads of hormonal action that may make it dense or too tender. You get what I mean? Now, breast examination, if you want to examine your left breast, look at the way to do it. First of all, go naked before a mirror, bring down 2 hands by your side, look and take note of the shape and size of your breast. The next is raise both hands, take note of the shape and size of your breast and spread it out and also take note. Now, to examine your left breast, use your left hand, put it behind your back, use your right hand, the pad of the 3 middle fingers, and place it on your breast and push your breast. You can do it in these directions I'm going to be showing you, either inward, outwards, from your nipple up, from your nipple down, from your nipple to the left. You get what I mean? Or you do it in a circular motion, clockwise motion. You move from the upper part of your breast, you move round, even up to your armpit, you move round, bringing it in until you close up to the point of your nipple. and note if there is any lump-like substance there, you know that something is wrong. Now you also repeat the same thing for your right breast. This time around, your right hand will be behind your head, and this will do the work. You can do this standing up. You can also lay down flat on the floor with your back and repeat the same process. Now after that, you take a look at your nipple to check if there is, apply a little pressure to check if there is any abnormal discharge. Now if one develops breast cancer, what is the way out? Any solution? Studies have found out that when breast cancer is discovered in time, the chances of cure are very high. The chances of cure are so high. Now there are treatment options. You have surgery, you have chemotherapy, that's with drugs, you have radiotherapy with radiations, and sometimes radiotherapy and chemotherapy goes hand in gloves in order to make the treatment effective. And surgery involves either taking out the lump in your breast or taking out the whole breast to avoid spread. You get what I mean? Now, how do doctors confirm that you have breast cancer? There is something known as biopsy, where the cells of your breast will be taken to the lab in order to check further if there are abnormal growth, abnormal development, and things of that nature. So now that you know about cancer, please take your breast self-examination serious. That is the only way you can discover cancer in time. Another thing is, maintain a good weight. Don't let your BMI, your body mass index, pass 24.5. Don't be overweight, don't be obese. Obesity increases the chance, as you have heard me mention in the previous post. Exercise regularly, reduce or avoid the intake of alcohol. This will help you reduce the intake of alcohol, maintain your weight, and exercise regularly. These are the steps you can take to help yourself. And also eat healthy. Please reduce the consumption of junks, reduce the consumption of non-profitable foods. Do a very high amount of vegetables and fruits, and this way you will keep yourself healthy, and if anything goes wrong, you will be able to identify it on time. So thank you for watching. Please share this video, let people see it, share it, let them come and learn. And please, if you've gained value, please do like the video, subscribe to my page, and turn on your notification for when further videos will be uploaded. I remain your girl there, Jane. Thank you so much.